Hi, once again, welcome to our channel, African Health Focus. And today, our topic is on the irrational use of antibiotics. Did you know that you don't need an antibiotic when you're treating things like common cold or flu? For sure, you don't need an antibiotic, and the reason is common cold or flu is caused by the influenza virus, and you don't use antibiotics to treat viruses. Antibiotics are used to treat bacterial infections. So what do you need to do when you have a common cold or flu is to relieve the symptoms. Okay, the symptoms that include if you have sneezing, if you have a cough, if you have a body ache or headache, or if you have congestion. So if you have a headache, you need painkillers like paracetamol and or ibuprofen. If you have sneezing or coughing, if you have sneezing, you need to use antihistamines like Piriton or cetirizine to relieve that symptom of sneezing. If you have a cough, it also depends which type of cough. We have a dry cough, and if you have a dry cough, you use antitussives or what we call cough suppressants. And if it's a wet cough, you need to use an expectorant that you remove you expectorate the mucus and relieve that congestion. But if you have a general body ache, you need NSAIDs and other painkillers to relieve that symptom. So ideally, you don't need an antibiotic when you're treating a common cold or flu. And the use of an antibiotic during that time has no rational reason for that. If you use an antibiotic, actually it's a waste of antibiotic, and the other complication that can lead to like resistance to that antibiotic. So please don't use an antibiotic when you're treating a common cold or when you're treating a flu. Just relieve the symptoms, and above all, you also need to boost your immunity by the use of antioxidants like vitamin C, which is important as a supplement. Use it to boost your immunity to avoid having flu or common cold more often.